Assalamu alaikum. Our today's topic of discussion is spleen. Spleen may we will see its location, its borders, surfaces, its relations, peritoneal and visceral, and its blood supply. So here we go with the location. Spleen is located on the left side of the abdomen. Spleen is located just below the diaphragm. It is covered by the diaphragm and it is situated behind your stomach, and it is located below the 9th, 10th and 11th ribs, and it lies in relation to the 9th, 10th and 11th ribs. The relations of the spleen will be discussed later. For spleen, we have this rule of odd numbers, that is odd numbers 1, 3, 5, 7 and 9 to 11. They apply to the spleen. So 1 corresponds to the thickness, which means 1 inch thickness of the spleen, 3 inches width, 5 inches length, 7 ounces weight, and it is situated behind 9th to 11th ribs. So this was the rule of odd numbers for spleen. Now we will try to understand the surfaces and borders of the spleen on a specimen of spleen. So here we have the specimen of spleen. So here is its sharp upper border which has small notches in it. Then we have this rounded and the thick lower border or inferior border. Then we have this posterior end which has a single angle and this anterior end which has two angles. These are the two angles, one and this one is the second one. So this one is here we have the hilum of, this is the hilum of the spleen. So from hilum enters the splenic artery and veins and lymphatics, and here the tail of the pancreas is intended. So this we can see the diaphragm, and this is the visceral surface of the spleen. Then this one is the smooth surface, which is the diaphragmatic surface. So these were the borders of the spleen and ends of the spleen. So now we can see its anterior border which has two angles. These are the two angles. This posterior end has a single angle. So this hilum of the spleen can be called as the intermediate border. So spleen is covered by a capsule. This one is the capsule of the spleen. So now we will see the relations of the spleen to the ribs. This is 9th, this is 10th, this is 11th rib. So spleen's longitudinal axis is determined from the 10th rib, and from the 10th, at the level of the 10th rib, from the anterior tip to the posterior tip is the longitudinal axis of the spleen. Now we will see the peritoneal relations of the spleen. Spleen is related to the gastrosplenic ligament and the lienorenal ligament. So both these ligaments cover the spleen from all around. So the spleen is actually intraperitoneal. We can see here how the spleen is related to the ligaments of the peritoneum. Now we will see the visceral relations of the spleen. So spleen is related anteriorly. It has stomach with the lesser sac, and superiorly or posteriorly हमारे पास लेफ्ट हेमी डायफ्राम आ जाएगा, और इसके एंटीरियरली हमारे पास पेनक्रियाज भी आ रहा है. देन हमारे पास हमने इसकी सुपीरियरली भी देख लिया, इसके इन्फीरियरली भी देख लिया. अब हम इसके पोस्टीरियर रिलेशंस देखेंगे. उसमें वी हैव दिस किडनी, लेफ़्ट किडनी विद द लेफ़्ट सुप्रारेनल मेनली, एंड लेफ़्ट सॉस मेजर भी होगा. सो now we will see the impressions on the spleen. It has basically 4 impressions. This one is the gastric impression, this one is the colic impression, this one is the pancreatic impression, and this one is the renal impression. So the gastric impression, colic impression, anteriorly हमने gastric impression देख लिया, and posteriorly we have this renal impression. So this hilum is related to the pancreatic tail. So this here is the tortuous splenic artery. Now we will discuss the blood supply of the spleen. So spleen is basically supplied by the splenic artery, which is a branch of the celiac trunk of the aorta. सो सीलियक ट्रंक से हमारे पास थ्री मेजर ब्रांचेस अराइज कर रही होती हैं. वन इज़ द gastric, left gastric, one is the splenic artery, and the other one is the common hepatic artery. So splenic artery, it runs posterior to the stomach, and it is highly tortuous. It reaches up to the hilum of the spleen and enters the spleen through this hilum along with the splenic vein and the lymphatics of the spleen. It is said that spleen has no specific lymphatics because it itself is a lymphoid organ, but it does have lymphatics which drain into the creaticolenal lymph group of lymph nodes, which lies posterior to the stomach and in front of the spleen, and then these drain into the pyloric lymph nodes, and from pyloric to the celiac group of lymph nodes. We can see the venous drainage of the spleen. Spleen is drained by the splenic vein, which runs posterior to the pancreas, and near the neck of the pancreas, splenic vein joins the inferior mesenteric vein and forms the hepatic portal vein. Now, if we talk about the nerve supply of the spleen, so spleen has both sympathetic and parasympathetic nerve supply. Sympathetic is via the celiac plexus, while the parasympathetic is by the vagus nerve. So this was all about the spleen. Thanks for watching. Do subscribe and like the video.